Our program is a 5-semester program. It is based on Greenwood campus. We have 20 students that we take in every year. We simultaneously have 2 cohorts at a time, so at any given point we have 40 students in our program. We rotate through several different clinical sites, and they start doing clinicals at 5 weeks into the program. So their very first semester we send students into the clinical field, and they are working on live patients. They work in the lab simultaneously on our mannequins. So this is Maggie West. She has completed 3 semesters of our program. She has 2 left to complete before graduation, and she is practicing hands-on skills regularly here. So Maggie, what brought you into the field of radiology? Why did you decide to do this?
Well, I thought I was going to do nursing for forever, and then when my brother became a nurse, I decided I didn't want to do it anymore. I still wanted to work in the hospital, and I did some research about just some jobs in the hospital, and I stumbled across radiology, and I loved it. It kind of fell into my lap, and I decided to do it.
So you have rotated through several different clinical sites, some being surgery and the ER. What is your favorite area to rotate through?
So my favorite place to rotate through is definitely the ER. I like the fast-pacedness of it, and I get to include my critical thinking skills, and it's just something new every day. You don't know what's going to come through the door.
Would you recommend this program to prospective students in the high school platform?
Yeah, I would definitely recommend this program to people in high school. I think it's a great opportunity for everyone, for males and females. It's a great way to go into the hospital if anyone was interested. The program can get hard at times, but it's definitely worth it in the end.
Radiology, for the past several years, we've had 100% job placement once they graduate and pass their board exam. The overall college has had a 96% job placement rate as well in the past year, and we know that there are allied health jobs open and out there. With them coming into our program, and we take students from all over, they're not always competing for just a job in Greenwood. They travel outside of the Greenwood County as well with these jobs that are open.
My name is Madeline Wood, and I am a CT technologist here at Self Regional Healthcare. A CT technologist is an imaging technologist. We take internal pictures of patients' bodies in a big donut machine, and sometimes we give them contrast, which highlights their blood vessels and helps us see internal organs a lot better. We see a lot of different patients. We get patients from the ER, some of our patients are outpatients, we get patients from the ICU, the CCU.
I'm Andrea, and I'm a respiratory therapist. We manage breathing treatments like albuterol, things like that for asthma, COPD. We also help with life support, so ventilation. We can work with any age, babies up until the elderly. We can rotate throughout the whole hospital so you don't get bored. You get to see everything. And you might do that in 1 week. You might work everywhere in the whole hospital, and that's what makes it fun. So you learn something new every day. I would say that I go home and feel pleased with what I've done. It makes me feel good, and I want to come back and do it all over again.
So students in high school really need to be thinking about where their life is going to go, what turn they're going to take. Allied health programs are a great way to start your research. There are so many different programs that we just offer at Piedmont Tech. It's always a great opportunity to have a good degree and a great job placement with a good paying job.